Hi. So as you can see, I've already kind of mise-en-plased everything, got everything set up, just opened up the packages. Everything's still sterile, nothing has been or has touched the floor or anything like that. Just set up, I have to keep it clean. Gonna start with the bag, just the infusion. Alright, so I have this right here, and I've undid the paper. Alright, so I have the bag here, so I'm gonna take this off without touching this. I'm going to take this off without touching that. I'm going to manually place this in here all the way up to the lip, as you can see. Upturn it, let that fill up to the line, and bleed it through. I'm over the garbage can as you can't see it, so getting all the air out of the line. Alright, I guess I'm going to push it through there till I get to the line, as you can see. Alright, so I'm going to stop this to keep it from dripping. And as you can see, well, you can't really see, but as I am looking, I see no air bubbles whatsoever. Actually, I see a few, so we'll let those out. And I'm just prepping this for the IV that I'm about to do. Alright. No more air bubbles. I'm going to hang this and keep this cap on here to keep it from getting dirty. I'll put that next to the arm. Alright, so now we're going to go this way and see if we can see that okay. Alright, so first thing we're going to do is look for the vein, which is an excellent vein right there. And then I'm going to get the tourniquet. One-time use. Go around. Can you see it? Yeah. Pop it through there so it's a quick release and easy. Alright, so that's good to go. Then I'm going to get alcohol. Refine the site. And wipe it 30 to 45 seconds, starting in the circular motion and then working my way out. Okay. So, for my J-loop, I'm going to flush that. That way there's no air in the line. Also the saline flush. Okay, and that is ready to go. There we go. And I dropped the saline flush, and I would normally throw that away because it wouldn't be sterile anymore. So, hypothetically, it's thrown away. Alright, the site is ready to go. Alright, I've got my needle, bevel pointed outwards, and this lip right here. Alright, so like an airplane, I'm going to land the needle right into the vein, wait for a flash. Oh, this has to be on. Okay. I'm not getting flash. I'm not sure if this thing is on or not. Let's see. There we go. Because I know I'm in the vein. I can feel it. Let's see. I'm sorry. I was not supposed to let go of that. I was just trying to turn the thing on, make sure, see if it was working or not. So I'll just say it flashed hypothetically, and then I'm going to push in the catheter, retract the needle. Oh, yeah, there's flashing. I'm going to take off the tourniquet. Alright. I'm going to place the J-loop onto the catheter IV. I'm going to pull back. The fluid coming out of this is clear, so you can't see it, but it is in because I was pushing it in, or it was leaking. I'm going to push the flush in. Take that off. I'm going to get the tachyderm here. And I've never used this one before, but I'm guessing it goes something like this on this one? No, it would not go that way. Oh, yeah, it needs to cover it. Let me see. Never letting go of the catheter. I'm just going to... Alright. I put it over it like so. I think I'm doing this... You know what? I'm going to get the other one. So I can't figure this one out for some reason. Alright, still holding on to the catheter. I've never let it go, even if I did in the video. I'm sorry. Alright. So I'll put this one on over it here. Oh man, I'm doing a terrible job. I'm sorry. I've done better than this. Okay, I'm just securing that in place, and then I'm getting some tape, putting it over it like so, and then another piece. It's a little long. And then I'll place this like so, right over that. Alright, so I'm not really happy with the way I did it just because the loop is right there, but it works. And then I'm going to take from the saline, normal saline, sorry, take this off, and, well, let me put that, well, I haven't touched anything with it yet, so it's still sterile, but I'm going to wipe this off with the alcohol, and then I'm going to place this onto it here without touching any of it. Screw that in place, and then I'm going to tape that piece into place so it doesn't go anywhere. Okay. Sorry, the tape is not very sticky. I think it was old. It looks like it's pretty old. So that's the IV, and this is off. I just did it. I throw everything away as I go. Try to keep it as neat as I can. Okay, and then I'm going to do the 0.5 milliliters of morphine. Let's see if you can see it. There we go. I undid the normal saline as well so it could drip. Alright, so for this, first thing I'm going to do is get the alcohol prep ready. I have a 3 milliliter, why can't my brain work? Not needle, but I'll just go with needle. And I'm using a demo sodium chloride injection as my morphine. So for that, I'll move it this way. Okay, put this here. Needle goes into the sharps. I'll keep everything like pretty clean. So I'll push this in here. Alright. remove this. Doing 0.5, so what I'll do is put air into the bottle first. Upend it, push it in, and then get the 0.5 out. And there's some air bubbles, so what I'll do is I'll flick it. And just make sure that I have 0.5. Turn it back over, remove, click it. So that's safety on, and that will go in the sharps. So this is ready to go. I'll put that in there so it doesn't touch anything. And then go back over here. Let's see. Here we go. And I have an alcohol pad to clean it. And since it's 0.5, it needs to go in slowly. I have a new flush. Get the air bubbles out of the flush. And push that in there. Oh, there's air bubbles in there. Let's get that out. Put that back in. Turn. Lock it in place. Push that in. Because you want to flush it first. Take that out. I have a second flush. But first I'm going to put the morphine in. I'm going to do it every 10 to 12 seconds. A little push over about 1 to 2 minutes. Don't want to cause necrosis or anything of that nature. So just a little bit at a time. Alright. By the way, I've already washed my hands before everything. I apologize, I forgot to say that. I looked at my orders. I prepped everything, got it ready. Made sure the patient, I got 2 identifiers. And I'm still pushing in that for another minute. The morphine. Alright, it's been about 45 seconds to a minute, and I have about half left. Okay, that's good. So I'm going to take this out. And then I have my other flush without any air. And then because there's still the medication in this, I'm going to do the same for this flush and push about over 1 to 2 minutes every 10 to 12 seconds, 10 to 15 seconds. Okay, it's now been about 1.5 minutes. So flush that, took that out, and I would obviously make sure this tape is secure in place. The tape, like I said, isn't very good, but I'll maybe see. Try one more. Just make sure it's secure. Get rid of this. And there you have the IV, the infusion, and the morphine push for 0.5. Like I said, I looked at the doctor's orders, checked the patient identifiers, kept gloves, everything sterile, prepped everything. I hope I'm not forgetting anything.